Kaiser, Kaiser, you can't hide. We can see your greedy side.
Part of that statewide strike is happening right here in San Diego at the San Diego Medical Center. You can hear lots of people out here supporting the workers that are striking here. Basically, they're asking for more mental health services from Kaiser. They're saying that their patients are being neglected.
When we can only get them in once a month or once every 2 months, it really prolongs their suffering and really prevents us from being able to do the work that we know how to do.
And if we don't get more staffing soon, we'll be marching till next June.
Dozens of mental health clinicians were picketing at the Kaiser Hospital in Kearney Mesa, demanding more staffing and benefits that match other Kaiser workers.
And the fact that they have never yet agreed to treat us the same as the rest of their employees, it proves to us that Kaiser still has not made the commitment to improve its mental health services.
Kaiser says it has hired more than 500 therapists since the beginning of the year. A spokesperson says it's doing its best while there's a national shortage of qualified professionals.
They are not offering those same terms to our mental health professionals, so it's hard for mental health professionals, I think, to consider Kaiser as an employer when they see basically that we're being retaliated against for speaking up about this issue.
Kaiser greed has got to go.
The strike was organized by the National Union of Healthcare Workers. Members also walked out last December. They feel demonstrating is the only way to get what they want.
We've done so in the past, and that's what has proven to push Kaiser to increase our staffing. The problem is, though, that Kaiser continues to grow and to add more patients. And while it adds adequate staff in other departments, we always have to push Kaiser to do that for mental health.
Those striking include therapists and psychiatric nurses who work with patients dealing with a variety of mental health issues.
Certainly the most common forms of anxiety and depression, oftentimes both. Certainly, yes, addiction problems.
Kaiser, Kaiser, can't you see? This is a healthcare emergency.
Workers say waiting 2 months for an appointment is simply too long.
In order for treatment to help, it's very well established that we need to be seeing patients weekly or every 2 weeks.
Caregivers plan to continue striking across the state this week unless a deal is reached. Kaiser officials say they're working through a mediator on a compromise, but the union walked away from the negotiating table.
This is NUHW's 6th notice strike within a single year. We believe that NUHW's repeated call for short strikes is disruptive to patient access, operations, and service, and frankly, irresponsible.
During the strike, mental health services will still be available at Kaiser, although some appointments may have to be rescheduled. Matt Hoffman, KPBS News.